Vertical Health Services is elevating care and enriching lives with a people-first approach each day across the country. Families walk through the doors of skilled nursing facilities carrying more than paperwork. They carry uncertainty and a quiet hope that the people inside will care for their loved one the way they would themselves. In those first moments, concerns begin to surface. Will someone take the time to explain what comes next? Will their loved one be seen, heard, and treated with dignity, or simply processed through a system? Vertical Health Services was founded with a mission to treat every resident and family with compassion, empathy, and a deep respect for their dignity. We believe basic care is the expectation, not the standard, a company spokesperson said. Our responsibility is to go beyond that, to create an experience where residents and families feel informed, respected, and genuinely cared for from the very beginning. Vertical Health Services is a healthcare organization managing skilled nursing facilities across the United States, focused on post-acute and long-term care. At its core, the company aligns people, processes, and performance so facility teams can focus on what matters most, patient care. Its mission, elevating care, enriching lives, reflects a philosophy grounded in dignity, personalization, and meaningful human connection. That philosophy is not aspirational. It is operational. From the outset, the organization emphasizes a structured, high-touch onboarding experience designed to reduce uncertainty and build trust early. Families are guided through care plans, daily routines, therapies, and expectations with clarity and compassion, establishing a foundation that carries throughout the resident journey. Speed and transparency matter, the spokesperson said. Leaving families without answers still communicates something, just not the message we want to send. We make it a priority to respond, to explain, and to be present. Rather than reacting to industry challenges, the company has built its model around anticipating them. We try to be what the market needs, the spokesperson said. We don't want to get stuck in one type of care delivery. We want to be able to pivot, adapt, and meet people where they are. An industry under pressure and a shift toward transparency across the United States, the skilled nursing industry is navigating a period of mounting pressure. More than 1.3 million Americans reside in nursing homes at any given time, with millions more cycling through post-acute care each year. As the population ages, demand continues to climb, with adults over 65 projected to make up more than one-fifth of the U.S. population by 2030. At the same time, facilities are contending with staffing shortages, rising costs, and increased regulatory oversight, all while expectations from families continue to rise. The result is a growing gap between what families hope for and what many facilities are able to consistently deliver. It's a complex environment, a Vertical Health Services spokesperson said. You have regulatory pressure, staffing challenges, and increasing expectations all happening at the same time. But those realities don't change what families need when they walk through the door. In response, Vertical Health Services has taken a more hands-on approach. Leadership is visible and engaged, not distant. Instead of relying on surveys alone, the organization places a strong emphasis on face-to-face conversations with residents and their families, creating opportunities for real-time feedback and genuine connection. We are in the service of people, and that means every interaction matters, the spokesperson said. Residents, families, staff, vendors, they are all customers in their own way, each with unique needs. Communication is treated as part of care itself. Families are guided through what to expect so they can feel informed rather than uncertain. Residents are engaged as participants in their care, not passive recipients. The goal is not simply to prevent dissatisfaction, but to build confidence. Experience has reinforced that approach. When you don't tell your story, others will fill in the gaps, the spokesperson said. And not always accurately. That lesson has shaped a culture where clarity comes first, not after questions arise, but before they do. Delivering a red carpet experience in everyday care for Vertical Health Services, care is not defined solely by what is done, but by how it feels. From the first interaction, the organization focuses on creating an experience that removes confusion and replaces it with clarity, dignity, and personal attention. Families are not left to navigate unfamiliar systems alone. They are walked through each step with intention. We want people to feel informed from the beginning, the spokesperson said. When expectations are clear, it creates comfort and trust. That approach continues well beyond admission. Personalization is treated as an ongoing process, not a one-time assessment. Care plans evolve as needs change, reflecting a deeper understanding of each resident over time. No two residents are the same, the spokesperson said. Personalization is never finished. It's something we continue to refine as we learn more about each individual. This philosophy extends into how the organization measures success. Stronger referrals, improved occupancy, and higher satisfaction are viewed not as isolated outcomes, but as reflections of trust earned over time. Families share experiences when they feel confident. Residents respond when they feel supported. Technology plays a role in supporting that consistency, but it does not replace the human element. Technology helps us stay organized and responsive, the spokesperson explained. But the experience people remember is how they were treated. In an environment often defined by complexity, the organization's approach is intentionally simple. Care should feel personal. And when it does, it changes everything. Vertical Health Services. It is our responsibility and our privilege to provide great care. At Vertical Health Services, leadership is not confined to titles. It is embedded throughout the organization, shaping decisions, guiding teams, and reinforcing a culture built on accountability, adaptability, and trust. That culture is intentionally designed. We try to be what the market needs, a company spokesperson said. Having a smaller ownership group allows us to remove red tape, pivot quickly, and empower leaders at every level to make decisions. The expectation is not just that leaders perform, but that they grow. Grit and consistency are the two most important qualities in a leader, the spokesperson said. You have to be willing to push through adversity and consistently do the right thing. That philosophy extends beyond internal operations and into the broader industry. The company's chief operating officer, Andrew Eisenbray, was recently selected as a Silver Award examiner, a role that involves evaluating systems and processes across the long-term care landscape. The recognition reflects both his expertise and the organization's commitment to advancing standards beyond its own facilities. It also reflects how Vertical Health Services views leadership, not as something contained within its walls, but as something that contributes to shaping the future of care. Inside the organization, that same mindset shows up in how leaders are developed. We allow people to take risks, even if we're not sure an idea will work, the spokesperson said. Sometimes the return is in the growth of a leader. Building leaders is the goal. That willingness to grow is paired with a strong emphasis on listening. The company's Voice of the Customer initiative is built around direct, visible access to leadership. Boards displayed in facility lobbies include the names, faces, and contact information of administrators and directors of nursing, ensuring residents and families know exactly who to reach when questions or concerns arise. That transparency is reinforced during the admission process, where families are invited into ongoing, in-person dialogue. There is no substitute for face-to-face conversations, the spokesperson said. We would much rather sit down with residents and their families and understand what they need in real time. That belief shapes how the organization defines service itself. Rather than framing care as something that can exceed expectations, leadership sees it differently. The concept of going above and beyond is something we do not subscribe to, the spokesperson said. It is our responsibility and our privilege to provide great care and great customer service. If you are truly vested in what matters to the customer, how could you exceed that? Only a customer can say they received more than they expected. Today, that awareness reinforces a culture where communication is proactive, leadership is visible, and decisions are grounded in both operational precision and human impact. At the same time, leadership remains grounded in the realities facing the industry. Balancing regulatory compliance with direct care at the bedside is one of the biggest challenges we face, the spokesperson said. We are working to leverage technology where we can, but the focus will always be on ensuring our teams can spend more time with residents. In the end, the organization's approach comes back to a single idea, one that shapes everything from leadership decisions to daily interactions. It's important for us to be flexible, transparent, accountable, compassionate, and responsive in every interaction, the company said. It's a principle that guides us every day.